Hello everyone, welcome to my channel. Today I will be discussing the landmark on OPG, that is also known as Orthopantomogram. This is the maxillary arch having permanent dentition, and this is the mandibular arch with lower permanent teeth. This empty space indicates the missing extracted first molar. On the right side, first molar is also missing, but the space is occupied by drifted second molar. The first landmark shown is Styloid Process. It is also seen on the right side. This is the Styloid Process. It is continuous with the angle of the mandible. Now the second landmark is the Styloid Process. It is a needle-like projection which provide attachment to the stylohyoid ligament, stylohyoid muscle, stylopharyngeus muscle, and styloglossus muscle. It can also be seen on the right side. This is the angle of the mandible. Next is the Mandibular Canal, which provide passage for the inferior alveolar nerve. A small mental foramen, typically adjacent to the root of second premolar, can be seen, which provide passage for the mental nerve. The next landmark shown is Maxillary Sinus. It is the largest of the paranasal sinuses. It is located above the teeth and on the side of the nasal cavity. It is the boundary of the maxillary sinus. It is largest of the all paranasal sinuses. A rounded orbital area could be seen. These are the orbits which are bony sockets for the eyes and associated structure. It protects the eyeball and its associated structures. Now this one is the nasal cavity, in between which nasal septum is present. This is the nasal septum. At the base of the mandible and at the level of C3, hyoid bone is present. It provides attachment to the anterior neck muscles. Okay, so now this is the zygomatic arch that extends from the temporal bone to the maxilla. It is not very clear on the left side, therefore I am mentioning on the right side. Now this is the radio-opaque shadow which represent the hard palate. It acts as a floor of the maxillary sinus. This is the condyle of the mandible, and this is the sigmoid notch. This is the sigmoid notch, which is present between the coronoid and the condyle. This is the glenoid fossa, which encloses the coronoid process, and together glenoid fossa which encloses the coronoid process, and together it acts as a temporomandibular joint. This is the external auditory meatus. I hope you all understand the main landmarks on the OPG. Kindly give feedback in the comments box. Please don't forget to subscribe and press the bell icon to get the future notifications. Thank you so much.